Hi everybody, Dr. Britt Talley Daniel MD. I'm a neurologist, headache doctor, writer with textbooks on migraine, and a big blogger. My webpage is www.migraine.com, and I certainly would appreciate it if you would subscribe so you can follow me, because I'm going to dictate more of these YouTube videos. Today the subject is, are triptans safe to take during pregnancy? Well, when they first came out in 1990, that was sumatriptan injectable. The FDA said then, and they've never changed that, for the nasal spray and oral types of sumatriptan or any of the other triptans, that they're safe to take during pregnancy, but time has shown that they are okay. So triptans currently are the best drugs for acute therapy of migraine, and something like 78% of patients who take a triptan drug at onset during a migraine, early on in migraine, will be headache-free within 2 hours. The problem there is about 20 to 30% patients don't respond, and there can be side effects from triptans, which can be common for some persons, but sometimes by changing to another triptan or lowering the dose, the doctor is able to get rid of those side effects. Now, there are also contraindications to taking triptans, which mainly include coronary artery disease, previous history of severe hypertension, angina pectoris, persons who had stroke, TIs. Those are contraindications. You really shouldn't mix the drugs. Now, when you get the triptan side effects, they're really not serious. They're really just a sign of vasoconstriction, like the smooth muscles in your esophagus will contract during that time. When you take a triptan, it gives you a tight feeling in your throat. And your brain, they're making your arteries, which dilate during migraine, making the arteries constrict because your arteries dilate during migraine. So it's a side effect of the drug, which is helpful for headache. But many times, just reassurance or dropping the dose or changing another triptan will get rid of that side effect. So, the question then is, for this talk, are triptans safe to take during pregnancy? And the answer is yes. That they've been studied extensively with many reports, and I'll go over some of that with you in just a minute. During pregnancy, the answer is that triptans are safe to take during pregnancy. They have no major teratogenic effect. Teratogenic means forms of deformed baby harming effect. But most of the data that's been done on triptans has been with sumatriptan, which is always the first and probably the most commonly used triptan, and the one that has best insurance coverage anyway. The other drugs that have been studied have been sumatriptan and rizatriptan. Okay, so related questions would be, are there reliable research studies showing that triptans are safe to take during pregnancy? And yes. Schaefer, starting in 2017, published an article in 2018, entitled Pregnancy Outcome After Anti-Migraine Triptan Used, a Prospective Observational Study. And that was highlighted at the American Headache Society in 2017. Dr. Dodick, who's a Mayo Clinic headache investigator and a professor of neurology at the Mayo Clinic, stated about that article, quote, "There's been some mixed literature suggesting that triptans can cause low birth weight infants, spontaneous abortion, and preterm labor, but not at this study, which was carefully conducted study. There was no evidence of that." Dr. Elizabeth Loader, an associate professor of neurology at Harvard, chief of the division of headache there, she moderated a session about this when the issue came back on Schaefer. And her statements were, quote, "It's nice to see yet another study that provides information on the safety of triptans when used during pregnancy. The point estimate for fetal malformation showed pregnancy exposure was not elevated, although the confidence interval is wide and some evidence of risk cannot completely excluded based on this study alone," she said. All right. She also said Glaxo maintained a registry on triptans used in pregnancy, which never showed any strong evidence of teratogenicity. All right. Another article was published in 2015 by Marchenko on pregnancy outcomes following prenatal exposure to triptan medications, a meta-analysis, and they found that, and I quote them, The use of triptans during pregnancy does not appear to increase rates for major congenital malformations or prematurity, but may increase the rate of spontaneous miscarriage, which is a low risk of that anyway. As at this time of study, I'm dictating this in January of 2020, 3 published prospective comparative studies confirmed there was no increased risk of major malformations reported with exposure to sumatriptan during pregnancy. That's great. So, should pregnant women, how should they first treat their migraines? We have to be reasonable here. Triptans are the big guns. You may not want to use the big gun first. So women can relax, and sometimes by relaxing, lying down, closing their eyes, not reading, they can get rid of their headaches. They should always do the migraine lifestyle, which is important. Always treat migraine with adequate sleep duration, stress management, adequate hydration. Sometimes massage of the head and back, neck, and shoulders can help. Women can use ice pack on the head, neck, and shoulders. That'll help for treatment. And all patients should avoid their migraine triggers like heat, stress, sleep deprivation, missed meals, and strong odors. Just don't go there. The simple pharmacological treatment for pregnancy headache would be Tylenol, acetaminophen, which is the main drug OB/GYN doctors will allow their patients to take. It may not necessarily be effective, but may give some relief. So the problem with that is that triptans are the best drug for acute therapy for migraine, and now we're released so we can use them. So that's the end of this discussion. Hope you do well with this. Please click on the subscribe part of the channel, and I'll see you again on another talk. God bless all you women with migraine. I hope you do well. Bye-bye.